Today's webinar, Parent Peer Support Providers, Roles Across Systems and Service Level Intensity, will be our focus. Please continue to use the chat box so that we know who is attending, sharing information. It's a great place for us to connect with each other as we go through the information today. Wanted to let you know that today's learning community is hosted by Fredla, and we're a partner in the National TA Network for Children's Behavioral Health, which is operated by and coordinated through the University of Maryland and funded by SAMHSA. My name is Millie Sweeney, and I'm the Deputy Director of Fredla, which is the Familyrun Executive Director Leadership Association. For those of you who are not familiar with Fredla, we are a national family-run organization with member organizations across the nation, from Alaska to Florida, who support children, youth, and families every day in all child-serving systems through parent peer support programs. There are about 120 family-run organizations across the country, and they were all started by families caring for a child or young adult with mental health or behavioral health needs. Fredla's mission is to build strong, sustainable family-run organizations and together influence policy and practice to support children and families. We are a partner in the National Training and Technical Assistance Center, NTAC. We collaborate with local, state, and national organizations, and we offer technical assistance and consultation to family-run organizations, states, other child-serving organizations and systems, and other stakeholders. So let's get started today by learning a little bit about who is joining the conversation with a really quick polling question. Tiara, could you put that up? So let us know, what is your main role in your work with families? Glad to see we have a number of parent peer support providers joining us, as well as supervisors and system partners. I'm curious if you mark other, if you would please put that in the chat box so that we have an idea of the type of work that you do. It'd be helpful. Okay, just another minute or so people have a chance to respond. We have 83 folks joining us today. Great. So it looks like we have a pretty diverse range of people joining. Great. Thanks, Tiara. Our focus today is on the unique parent peer support workforce. It's my hope that the information presented today will highlight the benefits of parent peer support and lead to a better understanding of the scope of services offered by parent peer support providers across all the child-serving systems. I'll also share strategies for accessing the support, as well as developing parent peer support programming and some of the outcomes. The parent peer support workforce is growing nationally, as you probably know, but it's taken us many years to reach this point. The role of the parent and family has significantly evolved over the past 20 years, largely due to the family movement. Families are now seen as part of the solution. They are advisors and advocates at the individual, group, policy-making, and system levels. And we're seeing a shift in attitude from you just happen to be a parent to you really have an expertise that no one else has. They are collaborators, sharing equally with all others in the system, planning and in doing the work, reaping the benefits, and resolving the challenges that arise. Professionals are beginning to really collaborate with caregivers rather than just serving them as clients. Families are peer support. Families raising children with emotional and behavioral disorders often feel isolated, frustrated, and stressed. The need for peer support is what brought families together in the first place, and caregivers provide effective support for other caregivers because they have experienced many of the same emotions and struggles. They provide respite, support groups, and many other services. Finally, the family role has evolved to where they are service providers themselves, being trained to do more than advocate and advise, especially in family-run organizations. They're making administrative decisions and taking on leadership roles in service delivery systems. They're being hired into positions that were traditionally only for professionals and degreed persons, and they're providing direct services in multiple settings, such as mental health centers, pediatricians' offices, health departments, schools, juvenile courts, and child welfare offices. Parent peer support is provided by caregivers who have been trained to use their own lived experience in parenting a child or youth with emotional and behavioral challenges to support other parents and families. This work is based on that specific life experience, not a degree, and can be provided in any setting or system in which children and families are served. Parent peer support providers strengthen families by enhancing families' abilities, capacity, and skill sets. They provide support, training and building bridges between families and providers, and they enhance resiliency of the individual and the family by facilitating the family's identification of services, coaching the family when navigating various systems, and sharing their own experiences strategically with navigating systems and building resilience. They fulfill a variety of roles that facilitate effective connections between families, service providers, and systems. The definition of parent peer support provider may be defined in your state through statute, certification, or a credentialing process, through Medicaid reimbursement language, your state, your county, or your organization. In general, however, the parent peer support provider provides support, advocacy, and assistance with system navigation to families based on their lived experience and their training. Now, parent peer support is different from adult peer support. Parent or family peer support is differentiated from adult or youth peer support in that the support is provided to the caregivers rather than to the children who are experiencing the behavioral health challenge. A parent peer support provider has received specific training on how to use their own experience to inform, support, and guide other caregivers and families. They assist parents in navigating child-serving systems and sometimes the adult system as well. Another differentiating factor is that parent peer support is oriented to building resiliency rather than recovery. SAMHSA defines resilience as an individual's ability to cope with adversity and adapt to challenges or change. Resilience develops over time and gives an individual the capacity not only to cope with life's challenges, but also to be better prepared for the next stressful situation. Optimism and the ability to remain hopeful are essential to resilience and the process of recovery. Increasing resiliency skills and promoting protective factors are integral to children and youth becoming adults, not as impacted by their experiences with emotional, behavioral, or mental health symptoms or disorders, including substance use. Lastly, parent or family peer support providers work with the entire family, often addressing the needs of more than one child in the family or the medical or behavioral needs of the parents themselves. Often a parent peer support provider may assist the family with stable housing, employment, or other healthcare issues. Thus, their training and supervision needs are different than those of adult peer support providers, although there are a few common training areas, such as confidentiality and documentation that they share. The way in which this workforce is employed is also evolving. Historically, parent peer support providers have been employed mainly by family-run organizations. Although family-run organizations, or FROs as we call them, remain the largest employer, parent peer support providers are now found in governmental agencies, managed care organizations, private mental health providers, and across child-serving systems through a blended model such as child welfare and juvenile justice. This graphic can be available to you. It's definitely part of the PowerPoint that's in the download box. And it provides more detail on the various infrastructure models that currently exist, including employment, training, supervision, physical location, and which ones require certification. The peer workforce has been steadily growing as a response to gaps and needs across the nation, such as the shortage of child psychiatrists and psychologists and geographic challenges that affect treatment options and access. There have been concerns over treatment, quote, compliance, unquote, and participation. Recidivism associated with some traditional approaches has been a concern and a gap, as well as the importance of family voice and choice and the need for skill building within families. Traditionally, parent peer support has been funded through grants and foundation monies, but that's changing. Presently, 30 states have included some language in their state Medicaid plans to reimburse for parent peer support services. In many cases, this may be for a very specific population of children receiving intensive services, such as wraparound or family preservation, and not reimbursable yet on a broad scale for all families. Payment rates for parent peer support, however, often don't provide sufficient funds to support the infrastructure of family-run organizations, and can put many organizations at financial risk if they depend on Medicaid. As more states move to cover parent peer support through Medicaid, additional funding is needed to support activities included in quality parent peer support, as well as the infrastructure of family organizations that provide much more than peer support and are vital partners in program and policy. There are ways to fund parent peer support using current funds. It just requires a shift in how monies are currently or traditionally used to cover parent peer support to address needs in that specific system. Diversity in funding is a must, and there is funding in every system to support such roles. The link on this slide is for a document outlining the types of funding at the federal, state, and local levels that can be used for family support. Let's do another quick poll to find out what services do parent peer support providers provide in your organization, your community, or your state. Please mark all that apply. Support groups, wraparound. And if you mark other, if there's something that's not on this list, please feel free to put that in the chat box. I'm not sure if it's letting us choose more than one. It could just be one. So maybe choose the one that is most common. Yeah, it only won't allow multiple clicks. This still gives us a good idea. And thank you for adding that to the chat box. Okay. All right, thank you for participating. Parent peer support providers can do a number of things, and we're next going to look at their activities. Thank you, Tiara. The graphic that you're, well, if I can advance the slide, there we go. The graphic that you're seeing now is part of a larger infographic about parent peer support activities, and it lists the standard activities often performed by parent peer support providers. Connecting with the family through their shared lived experience, engaging in policy making, providing education and information, navigating the often very complex systems that our kids have to go through, training, and advocating both at the individual and the policy level for families. Parent peer support providers offer a variety of supports, They provide empathetic listening and emotional support. They encourage self-care activities. They facilitate familial engagement with service providers. And they do a lot of modeling of collaboration between families and professionals and being very family-driven. What they mostly do is offer skill building for parents in ways that enhance resiliency, they enhance communication, advocacy, and other areas affecting the ability to maintain a child with complex needs in the home, school, and in the community. Nationally, we're seeing parent peer support providers integrated into all levels of intensity of service, from conducting outreach and education at the least intensity level to participating as members of treatment teams within residential treatment facilities. An infographic that details the type of roles for parent peer support providers across these levels is available for download in the download pod on your screen, but let's walk through some examples of the work that parent peer support providers are doing at each of these levels. At the least intensity level, education, information, referral. This could be staffing a warm line or offering connection to resources for a parent that calls in. They engage in peer supervision and managing programs, as well as being involved in policy making and advocacy. That includes holding leadership positions, such as chairing or co-chairing a policy committee at the local, state, or even national level. They're involved in data collection and evaluation, working with researchers on grants and assisting in more formal evaluations of programs. At the low intensity service level, they provide training to parents, to professionals, to others, and this often includes evidence-based curricula. They facilitate support groups. And again, they provide information and referral, including conducting intakes, being the first person to work with a family member to gather information to help facilitate entry into more formal services. Again, they're involved in peer supervision and program management, data collection, policy making, and advocacy. At the medium intensity level, again, in individual advocacy, information and navigation, individual intake and assessment, but they provide parent peer support directly, either individually or as part of a community-based treatment team as an added-on service that families can access. We see parent peer support providers fulfilling a care coordinator role, and in doing so, modeling and teaching for parents how to coordinate services and supports for their child on a more long-term basis. They do training, offer support groups. They're even part of respite and crisis planning. Again, we've got peer supervision and program management at this medium intensity level, policy making, advocacy, data collection, and evaluation. High intensity services. These include hospitals, residential programs, and emergency departments or emergency rooms. Parent peer support providers partner in intensive in-home services such as wraparound or home-based teams, as well as become part of the staff in psychiatric hospitals and in residential treatment programs. They're part of respite and crisis planning, including participating as member of mobile response teams. They offer training internally in these residential programs and hospital programs, as well as externally. Again, offering support groups, peer supervision and program management, policy making, and collecting data and being part of evaluating high-intensity programs. There are emerging roles for parent peer support providers as part of mobile response and support systems, as a member of inpatient treatment teams, and joining the staff of pediatrician offices. They're involved in collecting data and participating nationally to bring a parent perspective and a family perspective to policymakers, legislators, and funders. At this point, I'd like to bring on Maria Silva. She is with Allegheny Family Network to give everyone an idea of how this actually works in the field. So she's going to talk about Allegheny Family Network's programming and the diverse ways in which parent-peer support is provided in their state and their community. Maria?
Good afternoon, everyone. I'm Maria Silva, as she said. I'm Chief Operating Officer at Allegheny Family Network. I've been at AFN about since its inception 12 years ago. And as I started out in the field as a one-on-one peer support provider, and then I became a supervisor and senior supervisor, and then the Chief Program Officer, and now I'm the COO at AFN. I'm trying to get my screen advanced. Excuse me. There we go. Our mission is through peer-to-peer support, education, and advocacy. We partner with families of children with behavioral health needs in order to improve their quality of life, and we are a family organization serving Allegheny County in Pennsylvania. And for those of you that don't know, Allegheny County is actually the size of Rhode Island. We are a family-run organization. All of our staff are family members. 100% of our parent advisory board are family members, and currently over 75% of our board of directors are family members. Now for us, a family member is a parent or caregiver that has raised or is raising a child with behavioral health concerns. And this is someone who has typically assumed the legal, financial, educational, medical, and emotional responsibility of raising that child or youth. This may include the biological parents, grandparents, and foster parents. Not only are our direct care staff family members, but their supervisors are family members as well, and the executive team are family members, myself, the program director, and the CEO. We have several different programs at AFN, and we call our parent-pair providers here family support partners. Our staff are cross-trained to be able to work in applicable programs according to their lived experience, as well as heavily trained in other areas. Our family support partners receive at least 2 certifications or credentials, either in high-fidelity wraparound credentialing or Temple University strength-based worker credential, and also the Family Peer Support Specialist, which is Pennsylvania's name for the Fredla curriculum, as well as the test for National Federation of Families Peer Support Specialist certification. We create professional development plans for our family support partners and have one-day skill building per month, in addition to our trainings that we offer during our staff days. We do CPR, trauma-informed care, IEP training, SSI, SSD training, SOGI, which is sexual orientation, gender identity, and expression training, universal precautions, community safety, sexual exploitation of children, etc. We find it very important that our staff are highly trained in a multitude of areas. We also have a staff meeting per month, and we include those house trainings on boundaries and case notes, family engagement, court, being good partners, provider agency information as well. Every staff must take HIPAA compliance and mandated reporting in their first week of employment. And additionally, staff attend supervision weekly or biweekly. For some seasoned staff, where they attend trainings and any specialized trainings necessary for their individual program involvement. Our staff have a wide variety of experiences and are placed in programs that utilize those specialized areas of lived experience. Our programs have multiple funding streams. Our current budget is $3.7 million. Our largest funder currently is Allegheny County Child Welfare at $2.1. We've also received funding from Allegheny County Mental Health Department and have several other grants to diversify our funding. And as Millie said, it's really important that we maintain that diversity of funding. Our high fidelity wraparound team is funded through our block grant Medicaid reinvestment dollars. And PA Parent and Family Alliance is our statewide program that is funded by a statewide family network grant through SAMHSA, and they also receive some funding from the statewide OMSEC Office of Mental Health and Substance Abuse Services. Our programs all include one-on-one family support partners, helping families navigate through those systems, and they encourage that self-advocacy that is appropriate and effective. We provide resources, modeling, we attend court, IEP meetings, help families through SSIs and Medicaid applications, help them complete crisis plans and family planning, and collaborate very, very well with our provider agencies. Our Allegheny County Community Programs is our broad level, mostly case management program that we offer Many families come through that program, don't have a diagnosis, and are struggling to find out the meaning of their children's behaviors. And that program is able to help them navigate those systems and even understand applying for SSI or the evaluation. Our CYF, which is our Children, Youth, and Families, that's our child welfare program. It's a very much a team collaboration with child welfare and understanding system navigation. It's very value added. We find a lot of times families have a difficult time engaging with their child welfare case managers, and sometimes we can bridge that gap. We're called on often to help in those areas. We help families understand their rights and their responsibilities when it comes to child welfare. Our Fathers Involved Now is a program that's specifically for fathers. We encourage fathers to be part of their children's lives. We understand how important it is with children, especially with behavioral health concerns, to make sure that their fathers are part of their lives. And that is staffed by dads who have raised or are raising children with mental health or behavioral concerns. Our foster family support program was a grant provided by the county, and then it was taken over by the child welfare funding, and that helped to maintain placement of adolescent teens who are at risk for losing their placement due to the sudden onset of mental health or behavioral concerns. It's highly effective, and we found that having a family support partner with those foster families maintains our placements much better than not. High fidelity wraparound is what we call in Pennsylvania our joint planning team, and we have the PA Parent and Family Alliance, which is our statewide. Some of the things that we collaborate with is a lot of research and collaboration. Our family support partners and our leadership staff are involved in a variety of roles in every aspect of our systems, and as much as we can be part of those systems, we're often called upon by the county and projects within the community to bring the lived experience into conversation. We've been called upon by our child welfare colleagues to help with child welfare caseworkers, engage families, and often our presence is reassuring and calming for a family facing the difficulties of removal of their children or court stress, as much as we can be in those difficult times. We have been called upon by our county when a local mayor needed an understanding of a family member who refused to leave a condemned building. And I was actually on that case, and I was invited into the home. And when I had that conversation, I was able to ascertain that the reason they didn't want to leave was they could not find a place that would take them and their son's service dog. We worked with the family for about 2 hours, and we found somewhere where they could go within their natural supports that would provide a home to them while we were getting them long-term living arrangements met. Etudes is a specialized program right now in Pittsburgh that I'm part of a research grant there, and we review grant requests. So one of the things we did recently was brought a family voice to some of those grants, and I helped them understand how one of the things that they had said was that parents weren't always good at bringing back paperwork or giving paperwork for evaluations from the education system. And I was helping them understand that sometimes that system can be difficult for parents to navigate as well as to get those assessments back. So we also work with our county and provide focus groups for the county whenever they ask us to do that. We've done multiple different kinds of focus groups to bring the family voice. So not only are our family support partners part of those focus groups, but we bring up family members to participate. We think it's important to raise them up as well, to have advocacy skills and bring their voice as far as what their needs are in the county. I belong to a community psychiatric forum. I've participated since I was a family support partner in conversations with medical students, psychiatric residents, fellows, primary care physicians, and other specialists in understanding that family voice. We are part of a CYF housing support. Our child welfare department received a grant from HUD, and we were able to work with those families to help them utilize their tickets for obtaining housing. We have a project right now that's a research project for intimate partner violence and looking at how families with intimate partner violence who are involved in the child welfare system can benefit by having a family support partner and a caseworker who is well-versed and understands intimate partner violence. The NAPS program is our Family Support in Schools Research Project. That's the National Institute of Mental Health, the R34. And that, excuse me, is a research program in collaboration with Fredla. Our Steps to Connect is another program that we support families who are struggling with children who are part of the LGBTQ community. And these families oftentimes feel very isolated and angry and lack of understanding of what is going on. And we have a family support partner that understands that journey and connects very well with family members, meeting them where they are as they learn to have a different view of the issues and realize that we're there for their child's safety and finding a way that they can still maintain relationships with their children. We have System of Care Collaboratives. Our Ready, Set, Hear Our Voice is a specialized work group through our System of Care initiative through Allegheny County. We prepare family members to sit on county work groups. We prepare them to go, and then once they return, we have a sharing time where they share what they've learned with other community members, and we give them a safe space to kind of think about and break down what they've seen and heard. Many times they feel a little out of their element when they go and present at these work groups, and this is a place for them to kind of come back and debrief and get ready for the next time. Our supportive programs are staffed by family support partners with lived experience as part of their professional development and according to their skills and desires. We have been value-added to presentations and co-training sessions according not only in Pennsylvania but nationally. Our staff with lived experience make excellent trainers and co-presenters and often enhance these presentations. Our chat line is actually manned by a family support partner. It is not a crisis line. This line particularly is only during 8:30 to 4:30 p.m. It's a live voice, however, that answers the phone right away, and that person has lived experience, and it's a comfortable and warm and welcoming person on the other end of the line. This authentic sharing connects parents and caregivers right away, offering resources that she can offer or further support, referring to one of our internal programs. We have many support groups throughout Allegheny County, often attended by families that either no longer need our one-on-one support or those who want to begin to connect to the other communities in the area. Our social and emotional support events offer families a way of being part of the community and the bigger community at large. Oftentimes, and even in a big city, parents feel isolated and stigmatized right along with their children and youth. There's a feeling of community in these events and knowing that everyone out there understands the behaviors that are seen and offering these activities many times that our children are kicked out of, it brings that group together. Our GED program that we currently run, our adult education program, actually came out of one of our support groups in our North area office. Some of the parents were talking about how difficult it was for them to even get jobs or to understand what their children were doing, and identified that they needed their adult education, and we formed a support group, and that support group actually went out and found some funding for that, for our GED program. And I think I talked really fast, but I'm here for questions. I think we're going to be doing that at the end.
Thank you, Maria. Actually, that was fantastic. And as you can see from what Maria presented, the diversity of the type of services and type of supports that can be provided from one parent to another, and the variety of funding that's available and the systems that parent peer support providers can work in and throughout. So I appreciate you sharing that, and we will have questions. There's some great questions coming in when we get through the rest of the presentation. Moving on to accessing parent peer support, as this valuable support service expands, so is the way that you can access, develop, and fund parent peer support, and we're learning more and more about the outcomes. Maria mentioned one of the National Institutes of Mental Health research projects is a collaboration with Familyrun Organizations around parent peer support that just began this year. And that will lead to more information that can help the field and contribute to the literature around this. There is this increasing research around peer support, and it's a promising practice that is widely used and available. This caregiver-to-caregiver approach has positive outcomes for the child, the family, and really the system as a whole. For example, a randomized controlled trial conducted by Flores and colleagues found that parent peer support providers help connect more uninsured children with insurance, improve access, and eliminate disparities. Other studies have found that parent peer support programs are valued by parents and may improve emotional functioning and coping skills of parents of children with disability. There's evidence of some benefits to caregivers, including stress reduction, perceived social support, and increased engagement in services that in turn benefits the child. Parent peer support providers provide parents and children with a better understanding of mental health and resources, as well as reduce the rate of missed appointments and premature terminations from treatment, which lead to cost savings. For children, the use of parent peer support providers reduces lengths of stay in foster care and the number of out-of-home placements, and supports children remaining in school rather than dropping out. I got ahead of myself on that slide. Your most valuable resource for parent peer support are family-run organizations, or FROs. FROs have been providing this type of support for decades, and they have valuable expertise in training, coaching, and supervising this unique workforce. They can be strategic partners in all phases of implementation of parent peer support. The link that you see on this slide provides a list of family-run organizations sorted by SAMHSA region, and the full list is available for download on the Fredla website. We could also send that out with the slides and the other resources to those that are attending today. Maria had a great example of the family that were in a condemned building and how the system turned to the family-run organization for help in engaging this family and understanding what it was they were going through so that they could support them in the way that was working best for the family. And as Maria said, it turned out that they didn't want to leave because they had to find a place that would accept the support animal of the child. So that's just one of those great examples of how family-run organizations can partner in helping to support families. Recognizing the importance of competency training, and I think we have some questions about that, for both the parent peer support provider and their supervisors, we conducted a national survey of the experts in this field, the family-run organizations who've been doing this for decades, to develop a list of these parent peer support provider and supervisor trainings that are available in different ways. You can find this list on the Fredla website, which is www.fredla.org, and through the link that's on this slide. Another strategy to access parent peer support is to partner with or build referral pathways to existing programs in your state and community. Family-run organizations offer diverse forms of support, from information referral to intensive in-home supports, as evidenced by how Maria talked about the different ways Allegheny Family Network provides this. The programs are funded in a variety of ways to ensure that parents can access some form of support when it's needed. There are a great number of states that fund wraparound services. High Fidelity Wraparound includes a parent peer support component in the form of the family partner. Wraparound is usually targeted for children and youth with high or complicated mental health needs, so there's often strict criteria for enrollment in such programs. Statewide family networks are federally funded networks of family support, training, and leadership. They're usually operated by a statewide family-run organization, and a current listing of these statewide family networks can be found on SAMHSA's website. Many states and territories also have system of care grants that are focused on building family-driven, youth-guided, community-based, and culturally and linguistically responsive service and support systems for children, youth, and their families. Nearly all of these sites have parent-peer support in more than one form that you may be able to access. Again, a full listing of sites can be found on SAMHSA's website. So I want to turn now to questions and comments and have some discussion. We've had a number of questions, and thank you, Melissa, who's also with Fredla. She has been pulling those together for us. I'm going to start from the beginning, and Maria, if you will also unmute, because some of these are for you. So we have someone, Linda, who's curious about the training that parent-peer support providers receive, and is there a standard? I would say nationally, we see a lot of different ways that parent-peer support providers are trained. There was a listing and a link to curricula that are available through Familyrun Organizations. In states that are funding parent-peer support through Medicaid, there usually is a standard requirement for training. A lot of times this comes from the Familyrun organization because of their expertise in that area. But there are standards that are available. It's just state dependent. Some states use the national certification exam through the Federation of Families as their level of competency. Others have developed their own certification processes that require a certain amount of training. All of it should be focused toward the competencies that have been agreed upon for parent-peer support providers. Maria, maybe you could say a little bit about what the standard is within AFN and within Pennsylvania for training.
Well, you actually hit on it. We started out, again, 12 years ago with only high-fidelity wraparound and the strength-based worker that's offered by Temple University in the state of Pennsylvania. We then looked at the Federation of Families, the parent support provider model, and they have 11 competencies that we took as a guideline to find other trainings for our staff. We focused very heavily on those because we thought they were a pretty wide range of needs that could be addressed, and they would need it to actually pass that our certification and train that test that they had to take. Beyond that, much of it was learning as we went along. I'd be happy to send out a whole list of everything that we utilize. We do conflict resolution, we do ethics, we do cultural responsibility training, trauma-informed care. We've looked at anything that we could take part of for our family support partners to make sure that their skills were honed and appropriate so that anything that the families might ask them, that they would be prepared for. And we share that knowledge among our staff. We have 49 staff, 33 of them are direct care. They share all of that knowledge together, so they actually help each other even learn. Some of the things that we did early on is I actually went out and got certified to be a trainer for many of those skills. For example, I took the California Cultural Brief to do cultural competency training, and then we began to hone and develop some of that based what it would look like from the point of view of a family support partner, because boundaries can be a little bit different for family support. We worked a lot on IEP training and SSI and SSDI. A lot of families that we encounter need that information. We have a lot of provider agencies that offer those trainings as well. I hope I answered that question.
Mm-hmm. Yeah, thanks for answering.
Millie, this is Melissa, and I just wanted to remind folks that the link that you shared on one of the earlier slides with the map of the United States does have a listing of all the trainings available by family-run organizations, and it also includes a listing of training for supervisors of parent-peer support providers, and so that's also a great reference for people to take advantage of who would like more information.
And I think what we'll do is send that out along with the link to the recording. And Tiara, I'll get that to you so that that can be added, because I don't know if you are able to access from the link in the slides. So we'll make sure that you do get that. Supervision training is also absolutely critical to have a workforce. And there was a question later on about supervisors being trained. Supervisors need to have a really good understanding of the role that a parent peer support provider plays and just how tricky it can be to use your own personal experience in a professional way. It's a very unique workforce. I've said before, really only comedians are the only ones that use their personal experiences professionally, aside from peer support providers. So they run into interesting situations and things that can, bring up some negative feelings of what they've been through themselves. Supervisors have to understand that, have to be able to support them. Professional development is key, and being a champion for this workforce is one of the most important roles of a supervisor. Alan said one of the original benefits or principles of peer support was about the mutual benefits that peer support offers. He thinks it's beneficial to talk about what peers get out of this work. The relationships with parents they're working with should be mutually beneficial, which is absolutely true. I think we do find that parent peer support providers get into this work as a way to give back, as a way to help families navigate and find an easier path than what they themselves have gone through. This is more than a paycheck or a 9-to-5 job for them. Maria, do you have you've done parent peer support individually and continue to do that in many ways. What do you get out of that as well?
So interestingly, we always tell staff when it starts to be about you, it's time to leave. However, if it becomes more about not wanting other families to have to go through the struggles that we went through, it goes from me, and I to our community and bettering the lives of other individuals and really having that empathy and understanding that you don't want anyone else to have to deal with some of the difficulties of navigating the system that you've had to deal with. That's what we look for when we want our staff. We want it to be more about the give back and the empathy and the understanding of the difficulties that we face as parents and the isolation and the genuine desire to not let that happen to anyone else.
Mm-hmm. And that feeling when a family succeeds or moves past a barrier that's been in place for them for a while it's a good feeling.
It is a good feeling, and it's wonderful. Even in-house, what we've done is we've raised up those families because we want to share what we've done, and it's a wonderful thing when we have family members who move on to our parent advisory board and then move on to being a staff and then move on to being supervisors. And we have several of them here in the agency that have had that in their professional development plans and have been raised up. And that is the most satisfying thing of all.
Can you speak a little bit more to that? Because one of the questions was about best practices for supervision of parent peer support providers and the career pathway to become a supervisor, what that could look like. You touched on that in your introduction about how you move from one role to the next.
Right. So my degree is actually in computer science. So it was nothing to do with the mental health field, right? Give me a PowerPoint presentation. Let me work on that. This was completely different from what I'd ever done. But I did have leadership skills, developed much from being part of the PTA, being part of a Girl Scout leader. There were skills there that I was highly organized and highly ready to engage people and had skills in background in accounting. So some of that was built upon. When I took high fidelity wraparound, I have received that credentialing as a coach, knowing where I wanted to go with that. The Fredla's leadership training, the PTSP, we have the Temple University strength-based leadership training. So those were all pieces that I knew where I wanted to go and what I wanted to do, and had a supervisor who had her degree in actual social work and was able to guide me with some of that because she had also done it as well. So what we help our staff do when it comes, so to me supervisions and the professional development are a little bit separate. I have shared with you, Millie, my supervision form that I developed out of the Temple University credentialing when I had to receive that. We really focused on our strengths-based supervision practice So it talks about what are the concerns, what are the general concerns, what do we talk about when we meet with families. Staff share that. They share their concerns. It's an open door policy that we have, so we use a lot of practices that we have pulled from multiple areas of knowledge. When it comes to developing staff to be supervisors, we encourage them to pick trainings even beyond what we offer here, and individuals will come up and will say, I want to be a supervisor. And so our PDP plans for them will focus on what opportunities they have. We'll give them more to do. We'll give them opportunities to go to county meetings, to head focus groups, to lead the support groups more. So it becomes this development of on-the-job training, so to speak, along with our certified programs that we encourage them to, well, it's mandatory for them to attend, and any other training that we want them to do. Yeah, we require all of our family support partners to minimally obtain 2 certifications.
Mm-hmm. I'm thinking that it may be a good topic for another learning community to talk about that pathway and what should be in place and what professional development could be offered that helps that parent peer support provider move forward in their career. That is one of the things that's a gap in the parent peer support workforce across the nation, is having a career pathway and not being pigeonholed into the same role all the time. So I'm making a list of, out of the questions that everyone is posting, I'm seeing good opportunities for ongoing conversation within the learning community. If you haven't registered for our learning community through the Technical Assistance Network, please do so, because we will add these resources there, and we will continue some of this discussion on an ongoing basis rather than just through a webinar. Let's see if we can get a couple more questions in here. Very specific to, I guess, AFN, are the child welfare parent peer support specialists also foster parents?
There are a few. That was one of the requirements that we had for the foster family support program. They needed to be a foster parent to understand that relationship so that they could go and be with those parents. So the same thing goes with our Steps to Connect program, which is helping families who have children that have identified in the LGBTQ community. We have 2 family support partners that have that experience themselves. So we match up the lived experience with the need, and we typically make sure that when we go for these different funding opportunities and these different program developments, that we have staff or can hire staff with that lived experience that matches appropriately.
Mm-hmm. Okay, thank you. I'm seeing some other questions about like marketing to families for engagement, trainings and certifications that are recommended for parent peer support providers, which you kind of talked on what AFN recommends. It again is very state specific and sometimes organizationally specific. If there's a certification directly for doing parent peer support in your state, but other things that may be helpful is becoming certified or credentialed in providing evidence-based training curricula, such as Strengthening Families, Common Sense Parenting. Those are good certifications. Your state may have others that are required, that there are trainings that they go through. Are there others that you could think of, Maria?
There's so many. I wanted to go back to the part about the marketing, because I think this is really important to understand as well. So we all know that this is all about relationships. And so 12 years ago, the family movement was really starting to be more self-efficacious. And one of the things that we noticed is a lot of, and I'm from the old school, when I would go into these meetings and bang my hand on the desk. We have an Agents of Transformation training that we use here in the state that actually came out of Rhode Island. And I was one of those parents that wasn't welcome to the table, and we remember how hard we have fought to be there. And one of the things that we try really hard to do is help families understand the difference between advocating for themselves and doing it in an effective way and in a positive way. So we've really slowly, 12 years ago, started with having family support partners that could that were very good in communication and very good at seeing both sides of the story with providers and going to these meetings, and we led by example. And when we led by example, we were asked to the table more and more often. And when that happened, we were asked to bring families alongside. And we felt very strongly if we were going to bring families alongside, not only did we have to have staff that was trained, but we had to have family members that were trained. So we started to offer family members some of the similar trainings that we were offering staff so that they could come alongside and begin to be used at the county level. We did a lot of that, hey, we have someone that would be perfect, why don't you talk to them and they can give you their experience, to where now we're getting calls from the county on a very regular basis to have family come and present to the children's cabinet meeting, to the work groups. So it begins with those relationships and modeling and having staff model and gaining that trust, which I hate to say is we shouldn't have to prove ourselves, but we do. Unfortunately, I think sometimes we have to show our professionalism, and then those engagements of those relationships continues to foster that to where it becomes more the norm rather than the rarity.
Mm-hmm.
I hope I answered that marketing question.
Mm-hmm. I think you answered a couple, like about introducing parent peer supports into services, and there are some resources around that we can definitely include in what's part of our learning community, and get those out to people, like recommending first steps. And there will be some resources coming out around getting ready to provide parent peer support and what to put in place for that type of programming. There's a question about resources to look for funding if you live in a state where parent peer support is not covered. That was also a link that was included that we will send out as part of the resources. There is funding in every system. It just has to be identified and reallocated toward this. For example, Title I funding in schools, Title I schools are required to have a parent plan, a parent involvement plan. Part of that could be targeted to providing parent peer support providers to train, to host a support group. Lots of different ways that can happen. That's just one example. But we'll include that list that has all the sources of funding that you can tap into. And I'm looking at the time. We only have a couple of more minutes. I know we're not going to get to all these questions. I'm so thrilled at the discussion today. There's one about job
Millie,
description.
I mentioned in the chat box that we will, any questions we don't get to during the time of the presentation today, we will respond to and email out to everyone.
Okay. I think we can also include that in the learning community on the LMS platform, so that we can make sure that we continue this discussion. It's very important. Yep. We also can do follow-up. One of the things I wanted to point out in these last couple of minutes is that we do have contact information for Fredla here, included in your slides, as well as AFN, and the sources and the resources that we have used throughout this presentation are included in the last couple of slides so that you are able to access those. I'm not sure if we have time for any more questions other than, let's get this last one in, strategies for working with HR departments in making job descriptions that emphasize life experience rather than a degree. That definitely is something that we hear, particularly if you have a person using their personal experience in a professional way within governmental structures. And job descriptions are very rigid, and they don't really speak to the value of that lived experience. Family-run organizations have great examples of how you can write these job descriptions. Some system of care sites also have great examples. I think we may have some on our website. If not, we can gather some and would be happy to share those examples. And I'm sure that Maria, AFN has a number of job descriptions.
Yeah, we do. And because we are a family-run org, we are only we have an HR department that we contract out for, and again, it is something that isn't normally seen, but that is one of our prerequisites that they must have a lived experience. And we do talk about, we have an extensive interview process where we screen all of that. It really is about that lived experience. How much have they done? What kind of volunteer work have they done? Have they worked in any capacity in the field when we do that screening? But we're looking for some things that you necessarily can't get out of the book. And so it's important to have that lived experience, and that is what we put in our job descriptions. And when we have our contracts with the county, our child welfare contract monitors come out, and they want to see letters that shows explicitly from us what we saw in them that lends itself to that lived experience to match up with our job description. So I can provide anything that would help others with that as well.
Great. Okay, we are out of time, and there's still lots more questions. I think that based on the interest in this, we might ought to look at having another webinar around some of these things. Thank you very much for joining us today. I believe there is, Tiara, I don't know if it's a link to a survey question, to an evaluation, or if that is something that's sent out afterwards. But please feel free, if you have further questions, if there are resources that you think would be helpful or you need technical assistance, feel free to reach out to Fredla. That is an area that we specialize in and would be happy to support you in. Our contact information is included in the slides. Okay, so apparently the link for the survey will pop up at the end of this.
Thank you all for joining us, and thank you, Millie, for having me.
Thank you very much. I hope everyone has a great day. Please stay on for a little bit longer just to fill out that evaluation. It helps us to bring you information that is helpful to you. Thank you.